Okay, so my last video focused on looking at the relative risk of catching COVID-19 in New Zealand with the current Delta outbreak by vaccination status. And I had a few questions come up on the various platforms that I shared that on. People wanted to know the relative risk of death and also hospitalization. Now, we can't actually do death because there's luckily only been one death from the current Delta outbreak. So we wouldn't actually have the data to be able to make comparisons there. New Zealand's been able to keep it quite small and contained. So what I can look at, though, is the hospitalisation rate and compare your chances of having been hospitalised during this current Delta outbreak by your vaccination status. So first off, this slide at the moment is showing you where I've got this data from. It's from the official government health statistics that are released. You can look them up yourself. And the numbers that I'm using today were taken at 9 a.m. on Saturday, the 16th of October, 2021. Okay, so we will get the number of cases that have been hospitalised for each of these groups, split by non-vaccinated, one vaccination and two vaccinations. And I am including in those two groups the cases that were vaccinated for less than 14 days when they contracted COVID-19 and became a case, even though we've been told the vaccination doesn't really kick in properly until 14 days. Just for ease of doing the calculations, I've still just included them in those groups. And then we need to know the total number of cases that happened within each of those vaccination status groups so that we can work out the probability that if you're in one of those groups, that case then became one that was hospitalized. Now, this is a type of conditional probability where we're looking at the chance of a case given that we know that they have become a case, so we know that they have contracted COVID-19, what is the chance that they then become hospitalized? To do that, we do this division. So we've got 124 hospitalized cases out of 943 cases. That's 0.131 or 13.1%. With each of the others, I'm just going to put them as percentages for easy comparison. Which leaves us with the relative risk calculation left to do. So we do this by dividing one chance by another. So we have the 13.1 divided by 10.1, which comes to 1.3, meaning that the cases in this Delta outbreak in New Zealand were 1.3 times as likely to be hospitalized if they were not vaccinated compared to if they had one vaccination. Now, for the comparison between the double vaccinated, we need this 4.4 and the 13%. That one comes to 3, meaning that the cases that we've had for this particular set of data in New Zealand were 3 times as likely to be hospitalized if they were not vaccinated compared to if they had 2 vaccinations. So this was just looking at the probability that if we know they have contracted COVID-19, what is the chance that they then become severe enough that they need to be hospitalized? And you can see those relative risks there.